they do a glioblastoma surgery, they cut open the brain and then they give 4-aminolevulonic acid, and that causes the glioblastoma to light up to light up when you shine a light on it at a specific wavelength, and you can specifically remove the glioblastoma tissue because it's lighting up from the high porphyrin content. So I'm interested in that not because of through photobiomodulation of enhancing that oxidative stress, but for the patient to achieve therapeutic ketosis. We use glycolytic drugs, and then we give them hyperbaric oxygen in the context of something that drives this porphyrin overdrive effect, like 5-aminolevulonic acid. And then you give a substrate like oxygen, then you cause a massive oxidative burst that's relatively, almost completely non-toxic to the healthy cells, but you're targeting the cancer cells. So what I just described here, like a neuro-oncologist will say, yeah, okay, that drug, yeah, we know that drug, but they have never probably thought about using that drug in the context of what I just described.
Right.
Because most people don't know about ferroptosis. They don't know about porphyrin overdrive. These are things that we see in the lab, and it's like 100% fatal for glioblastoma cells and 100% non-toxic to normal healthy cells. These are things that are available. I could go on Amazon, I could go on eBay and buy these drugs, and I think we are very passionate about moving this basic science into human clinical research.
So based on everything that you've said so far and what you know, would you expect that people who go on therapeutic ketogenic diets, at least intermittently, and or people who take exogenous ketones like BHB, would you expect them to have lower rates of cancer over time?
In theory, yes. So that's what we're talking about, cancer prevention. And the flagship journal of the American Cancer Association is, it's got an impact factor of 500. I didn't even know that was possible, but apparently I had to fact check that. So they had a massive review on the preventable, basically lifestyle, preventable things for cancer. And of the top 12, I think 9 of the top 12 were all things that are kind of lifestyle things, and smoking was like the top one, but that's probably be replaced by obesity and metabolic health. But yeah, and I think just simply, enhancing your metabolic health and being on top of just normal healthy weight and like things that we've learned, historically are powerful prevention. But I think periodically going into a state of ketosis could potentially purge the body of precancerous cells, because it puts tremendous metabolic stress on these cells, because cancer cells are quite vulnerable when they're in their pre-cancer stage. And the immune system is much more adept to seeing them and neutralizing them. But when they start to grow and proliferate, then they become, and they go from stage 1, 2, 3, 4, then they become a harder target
They can basically create an environment where they're more camouflaged, they're protected, they're less vulnerable to the immune system. So getting them before they are full-blown cancer, when they're precancerous, is often a really good time for that to happen.
Absolutely, because when a cancer starts to grow, it dumps lactate into the microenvironment and then makes it difficult for immune recognition. So, but what a ketogenic diet does, by limiting glucose availability, the production of lactate by the tumor is dramatically reduced. So it decreases the dumping of the lactate into the microenvironment, and then enhances the immune system's ability for the T cells to recognize the cancer and neutralize it.